Hi, this is Debbie Pate. We're going to talk about the educational pathways and the expanded role of the LPN to RN. So let's begin with looking at the educational preparation. You know, there's only one registered nurse's designation which exists. It doesn't matter if the person has gone through diploma in nursing, an associate degree, or a baccalaureate, a 4-year degree. So I just want you to understand that. It depends. So we're all being tested at that same level. There's different accreditation of the programs of nursing. You have the NLNAC, which we have that here at this college, and then the Commission on Collegiate Nursing Education. A nursing specialty nursing certification, the American Nursing Credentialing Association, is a subunit of the ANA. And ANA offers 39 different certification programs. Many nursing organizations, such as the Association of Critical Care Nurses, the Emergency Nursing Association, and the American Association of Nurse Anesthetists, offer certification opportunities. The licensure for the RN, they're going to test you in these different areas. You will see when you take your HESI test that many of these same areas will come up that you will have been tested in. So they're going to look at the 4 main categories: safe, effective care environment. Safety is always key. The psychosocial integrity, the physiologic integrity, and then the adaptation of that physiological part of the patient. So they're going to look at the management of care, which that's what we're into right now, the safety and infection control, health promotion and maintenance. Then they are going to look at some of the basic care and comfort, pharmacologic, parenteral therapies, and then the reduction of risk potential. Safety is always key though. So educational pathways for an LPN. As we mentioned before, it's considered directed in that the LPN functions under the direction of the RN, the physician, or other healthcare provider. They're also a provider of care in settings where patients are experiencing common health problems and focuses on meeting basic needs. They are considered a technical nurse. The registered nurse, in 2004, the ANA defined nursing as the protection, the promotion, and the optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. So you can see it's more comprehensive. So the 3 primary roles that the RN will focus on and work within: provider of care. The RN will provide competent nursing care. They're a critical thinker, teacher, collaborator, and patient advocate. As a manager of care, the RN is going to prioritize and manage patient care. They are a delegator and a decision maker, so they can work independently off of their decisions. They're going to practice legal and ethically and function as a manager of care. Now, as a member of the profession, the professional RN assumes individual accountability and responsibility and embraces lifelong learning. The professional RN participates in professional nursing organizations and participates in research and activities that benefit the global community. We want to look a little closely at the responsibility and accountability, because sometimes there is a conflict in the RN's mind because they feel like if they're held accountable for everything and they're responsible for every decision that's made by the ones that are working under their care, they're managing at that point, they have a problem with trying to do all the work then. But they have to understand that important concepts in this area of professional nursing are professional responsibility and accountability. And in the Code of Ethics, this is how it's explained. Responsibility is defined as accountability for performance of the duties associated with a professional nurse. Accountability is defined as being answerable to oneself and others for one's judgments and actions in the course of the nursing practice, meaning that if something's delegated, the RN knows that the person that has taken that responsibility has been trained and is accountable for that educational level that they're at in order to perform that designated responsible act in managing the patient. So we're going to get more into delegation and the right way to delegate, not in this session, but there is going to be a session on that. So the ANA nursing agenda for the future, they're saying that leadership and planning, delivery systems, legislation and regulation policies, professional nursing culture, recruitment, retention, economic value, work environment, public relations and communication, education, and diversity. These are what the different associations that are professional nursing organizations are focused on. So you'll see this as you become members of these professional organizations. Some of the ones that we encourage you to be a part of will be the Florida Nurses Student Association. We'll go to that conference, but as you graduate, you will progress to the American Nursing Association, and that represents the nation's 2.9 million registered nurses. These are the ones that they're going to foster high standards of nursing practice. They're promoting the rights of nurses in the workplace. They're going to be projecting a positive and a realistic view of nursing and participating in lobbying efforts in the health care issues that affect nurses and the public. Professional nursing organizations are many organizations that are dedicated to a specialty care and a specialty practice. And as you belong to one of these or many nursing organizations, you're going to provide education and socialization in nursing. Scope of practice. They're going to identify the responsibilities of the nurses depending on the educational preparation and licensure. Now, we spoke about this earlier, and it's defined by an individual state Nurse Practice Act. And the individual state boards of nursing, which are located in varying government organizations at state level, commonly exist to protect consumers of nursing care by regulating the profession. So I wanted you to be able to look at the Nurse Practice Act for Florida so you would know what you're held accountable to. If you have a lot of reading time, you can look at it and you can see what the LPN Nurse Practice Act says, the scope of practice, and then look at the RN. But specifically, let's look at the RN today. For the RN, each state has their own Nurse Practice Act. That's your scope of practice. I want you to find the Nurse Practice Act that you will be practicing under in the state of Florida. I gave you the website there, and I want you to specifically read the RN section on page 7. As I read it, some of the things that stood out were that we are considered a professional nurse, and we're supposed to perform and have actions that are at that level, meaning that our knowledge, our judgment, and our nursing skill is based on that level. Having a basis of applied principles of physiologic, biological, physical, and social, and psychological sciences, which shall include but not limited, allowing us to observe, assess, diagnose, nursing diagnose, plan, intervene, and evaluation of the health care. That's that nursing process. That's what allows us to be able to accomplish that and to be good and become experts at that. We're going to be able to administer medications and treatments as prescribed or authorized by a physician or a duly licensed practitioner in that state. And then we're going to be able to supervise and teach other personnel in the theory and performance of any of the above acts. Our scope of practice, the NCSBN, is a unifying body for the State Board of Nursing, and the ANA's publication, Nursing Scope and Standards of Practice, as talked about in your book, it addresses the scope of practice and delineates the practice and professional performance standards and measurement criteria for RNs. You should look in your book and you should look up those 6 standards of practice and the 9 standards of professional performance. They are as follows. The 6 standards of practice, it's just that nursing process again: assessment, diagnosis, outcome identification, planning, implementation, and evaluation. So you can see how important that nursing process is. 9 standards of professional performance according to the ANA: quality of practice, education, professional practice evaluation, collegiality, collaboration, ethics, research, resource utilization, and leadership. So as a professional nurse, this is what the American Nurses Association is saying that we as a profession should be involved in at some of our local professional associations, statewide, and then national level, because they are the ones that are looking out and lobbying for us, and they are our voices in making some decisions about our practice. All right, thank you. Next, our next session will be talking about a professional portfolio, and it's just going to be a PowerPoint, and I will send to each of you my own curriculum vitae that we've used. I think I've updated it 2 years ago. I haven't updated it since I started with my nurse practitioner. So I wanted you to have that so you can see how to complete your professional portfolio, because that's coming up soon. And you can have the example of creating your own resume. Okay, thank you. Bye.